through the session, if you can use the chat function to ask any questions, and then I'll look at those and see, if there's any duplication, and call on everybody to put those questions, or I'll read them through for Paul and Lisa as we go through. So can I just hand over now to you, Paul? Thank you.
Okay. So do I need to have permission to? Do I need to request control, Alan, first?
Yeah, sorry. Yeah. Right, we see you there. Right.
Okay.
Good.
Bear with me, I'll close my screen.
So is that okay? Can you see that okay?
Mm-hmm.
Going to move this across. Okay, so just what I wanted to do, just to really set the scene literally for the first 5 minutes, was just to talk about what I wanted to go through today. And obviously it's a discussion webinar, so it's not for me to preach at you. It's just to set the scene about where we are with antibacterials and antivirals. So if you look at, so what we want to go through today is really how the viruses differ from bacteria, how can we best protect ourselves, and then what to look at, good and bad. And I know Lisa and I have lots of feelings about this that we'd like to share with you today, and I'm sure other people have as well. So just to see where we are today, in terms of where you will find the biomaster products which are antibacterial, the most common you'll find is in lots of Bags for Life with Asda, Morrison's, M&S, Aldi now have extended their trial, and also at Tesco now, they've now got small trials going on. So you'll see the products out there a lot. Other SOFHT members, Hillbrush there have got a cleaning equipment range. You'll see us in very famous items like the Dyson Airblade, and more and more so now in things like textiles and workwear, which I'll come on to with the antivirals. What's interesting is that when we've looked at bacteria, we're always looking at protection of a test method that is a 24-hour test method. Now, although we reduce bacteria in 80% in around 15 minutes, we're looking for a far longer duration for the actual bacterial protection. And what's interesting is if you look at how both of these work, our products are designed against bacteria where the bacteria
You've put yourself on mute, Paul.
Sorry, is that back again?
Yes.
It is. Yeah, you're back with us.
Yeah, sorry, I'm not sure what happened then. It just said someone had muted me. I'm not sure what had happened there, but
Wasn't me, I promise.
It's okay. Did you catch that last slide? Where did I mute out from?
Would you like to talk us through it again, because we lost you soon after the slide came up? So
the very first slide, Alan.
The one viruses versus bacteria that's up there now.
Okay, so
you just started speaking to that when we lost you.
Oh, okay, sorry, I don't know what happened there. So okay. Yeah, with viruses against bacteria, it's not versus as such, it's just the comparison. So typically when we are challenge testing with bacteria, the bacteria themselves are living for 16 weeks plus. So we saw that in things like Bags for Life, we can keep them viable for 16 weeks. Sometimes up to 40 we've seen in NHS studies. When we're looking at viruses, the distinct difference, which is what I wanted to base today around, was that viruses are only going to remain viable for up to 3 days. And after 1 day, we're going to see quite a dramatic drop off. So what that means is that when we're doing testing, we have to really, I've got to get action back here. There we go. Yeah, so when we're doing testing on them, we're having to go for far shorter time periods. So this is a typical result we're having on SARS-CoV-2 on a non-porous surface. And typically this would be a polymer or a coating. So if we were to have that sample only and have no biomaster in there, we're going to get pretty similar results after 24 or 48 hours. So it's all about what is the benefit in a very, very short period of time. And we think this is critical because I have seen products out there that say, oh, our product reduces COVID-19 or SARS-CoV-2. And there's no mention at all of actually basing this on a control. So those results there, where we say 2 hours, it's 60% better. That is based against a control, which is actually dying off in viability very, very quickly. And I think that's something that people need to be aware of, is if you are looking at products, you need to be careful that the virus itself is going to die off much quicker than a bacteria, and you must have it compared to a control. The test method, the 21702, actually doesn't stipulate that you have to stress your results against a control. And so we are finding that quite a few people are just putting results out there that might be slightly confusing to people. On a porous surface, that would be something like paper typically, we're getting a much bigger action, and that's because the biomaster additive itself is actually more open, and the virus itself can have a direct interaction. So we're coating a paper. So you can see very, very quick results. And this is something now that, again, if you look at things like with the greeting cards at Christmas, you think about schoolwork, anywhere teachers are not having to, some of them aren't marking the work for 2 or 3 days because they're worried about viruses, gives you very, very good performance in such a short period of time. But again, if you had no biomaster in there, as we know, after 24, 48 hours, you're going to get a pretty good reduction anyway. So what I was just going to do, again, it wasn't going to be a long speech, it was just to really set the scene. Here are some customers that are typically launched already with a viral product by using their results compared to a control, which is obviously the critical part. That's James Cropper Paper, did the greetings cards. Polygene, who I showed a picture of them with the textile and the workwear earlier on, they're now very big into viral off products. That's anything from masks and gloves and also workwear. You can see there also the Asda shopping trolley in a project we did with Wanzel and a certain coating company. Now that's been very successful. It's not only on the shopping trolleys, on the basket handles, it's on the fridge handles. I know also we've got Martin Brower on today, listening today. They've coated a lot of their key touch points in their distribution centres. So it's something that has been tested. We've had both bacteria and SARS-CoV-2 results for those. Very easy product to use, and it's something that is proven to work against a control. And then the other one we're showing there is, it's quite interesting since COVID-19, the aircraft industry before really didn't want to speak to anyone in antibacterials. I think because they didn't want to open Pandora's box about how dirty aircraft are. But now we've been inundated, and this is the first launch we've done with a business class and first class seat manufacturer, which is MGR Foamtex. And that's all I really wanted to say, Alan, just at the start, was just to set the scene in terms of the difference you need to look out for in terms of antibacterial and antiviral testing. And I just wanted to give a couple of examples there. So hope that's helped.
Okay, thank you. Lisa, can we bring you in now? Is there something you'd like to add to Paul?
Yeah, certainly. I mean, one of the things that's really been interesting is the fact that everybody seems to have woken up to hygiene suddenly. I mean, Paul and I have been working on the Campylobacter, for example, on packaging, and people in shops getting Campylobacter or E. coli on their hands, and the potential concern about shopping trolleys and baskets and so on, and the fact that, you know, years ago we were wanting people to be able to sanitize their hands when they went in and came out of a shop. And all of a sudden now, because we've got COVID, this is all, everyone seems to have woken up. So, you know, as a public health professional, I'm quite excited about the fact that we're now going to be protecting people not just from COVID when they go shopping, but also anything else that might be hanging around, whether it's on packaging of meat, fish, poultry, or even when they've been handling raw vegetables. So I'm excited that there's going to be an improvement, I hope, in hygiene, and I hope that that is going to be sustainable. But equally, one of the things that's been worrying me have been some of the wild claims made by people about how long certain products can last on surfaces. And of course, you know, if it's just a chemical that's being spread onto a surface, then we've got to think about what's happening in use. You know, so often people will be touching that surface and removing the chemical from the surface, and perhaps depositing some microorganisms themselves in place of the chemical. So in a laboratory, it's one thing, and a lot of the testing that's done is related to a laboratory test rather than an in situ and in vivo situation. And I think that's an area of research that needs to be examined a little bit more. What actually happens to these products when you use them in reality? Are they actually such an amazing product? Are they going to last on the surface if they're just a chemical, for example? How will that work in practice? And as Paul said, what's really interesting, of course, is that this virus does reduce its sustainability after around 3 days, depending on the surface. And so that also needs to come into this. And I think in terms of sustainability, what we need to think about is spraying chemicals all over the place, willy-nilly. Is that really a good idea? Is it necessary? I'm a real proponent of targeted hygiene, which is making sure that you disinfect in the right place at the right time in the right way. So it's a bit like Martini or something, really, or the old adverts. But this is what it's all about. Let's not waste our resources. Let's not be taken over by people wanting to sell us chemical bombs that are going to deep clean premises miraculously and all the rest of it. And let's think about the environment, let's think about sustainability, and let's think very sensibly about what we're actually trying to achieve and where we need the disinfection to take place.
I think, Lisa, we've spoken many times and been on many conferences with the Chilled Food Association, and the uproar when they were reducing the usage of quat and the MRLs and carrying through into food. Obviously, we thought some of those levels were too low, but they were still pretty low. Now you switch on the TV and you'll see someone opening a school and just literally going around with a fogger spraying quat everywhere, all over the children's clothes and schoolwork and school desks. And it just doesn't fit with what people know about certain biocides and where they should be used. And I think it's that, it's almost like the fences have come down about where you should use a biocide safely, and where people just say, well, I need to open up, or I need to open my restaurant, or I need to open my school. There's no joined up thinking. And I think that's the most concerning part.
Yeah, absolutely. I mean, what really concerns me is this deep clean approach. Oh, we've had a case of COVID, therefore we need to deep clean. Why do you need to deep clean? What on earth are you playing at? Really, for a start, if you just shut the building for 3 days, that'd be it. It'd all be over. Then that would save an awful lot of chemicals. But really think about the frequently touched surfaces. Those are the things that need disinfecting. Don't worry so much about the floor and setting sort of fogging machines all over the place. It really is unnecessary. And I think we just need to take a step back and also remember that this is a respiratory illness, and it's mainly transmitted through droplets and aerosols. And I'm so worried that people get so fixated about the deep clean thing, and they're not actually thinking about how can we make sure that the building is safe. How we need to open windows, we need to get ventilation better, we need to space people out. And of course, you need to clean the frequently touched surfaces, but let's not waste all our resources and money and give ourselves a full sense of satisfaction by setting off some sort of, fogging or deep clean device, which actually isn't necessarily going to help at all. And it certainly won't help the reduction of spread between one person and another if they're in the same room and they're too close.
I noticed, Lisa, that there's the claims for reducing or removing COVID has started to creep into the TV advertising now, isn't it, for some products that have been around for a while. But it's interesting you mentioned the point about droplet spread.
Do you mind if I put this? It's a conference call.
Sorry, that wasn't a comment for me, I think. The whole point about droplet spread is largely lost, isn't it, in all the hype that we get and the stories in newspapers. Deborah Smith has raised a point there. I totally agree with you, Lisa. And Fiona Fleming has made the point that they've had to challenge back a lot with suppliers who think that fogging the area and people generally is the answer. Very early on, we had a discussion, didn't we, about some of the airports in the Middle East that very quickly introduced a system where you had to walk through a fogging area before you were allowed past customs and so on.
Yeah, I mean, there is a need for people to wash their hands before walking through customs. And I remember saying this in February, and it was falling on deaf ears. So, you know, there was a need for hand washing. There was a need for frequently touched surfaces to be disinfected. But, you know, by fogging people, you're not actually going to stop them spreading the disease through droplets or aerosol. And there's a negligible amount, if they were carriers, that would be on their clothing. So, you know, I think this has got to be treated in common sense terms. And as we open up the schools, for example, in a couple of weeks' time, I really don't want to see chemicals being thrown all over the place willy-nilly, when in fact what they need to be doing is thinking about the times when they need to disinfect, making sure that everybody is washing their hands or sanitizing their hands before coming into school, and then at key points during the day, and then having a regime where they're using chemicals safely on frequently touched surfaces to reduce the spread if there is anyone in the school who is infected.
So, Nikki, you've placed a comment on the chat line here. Would you like to speak to that and share it with everybody? Hello.
Hi, sorry. Yes, hi, I'm Nikki. We're here, a number of my team are here. We're very interested in this because what I've put as a comment is obviously we are a chemical manufacturer and we are increasingly concerned with the huge amount of claims we are receiving about residual effectiveness, testings, and references to old EN test standards being used. There is a huge number of new entrants that have come into our market that really have no real other than to make a lot of money and then leave the market. And unfortunately, this is very concerning, because obviously our role is very much obviously as a reputable, and we also have a UCAS accredited testing lab. So we do a lot of testing on bactericidal, not virucidal. We put that out to third party. But I think what we're seeing is our technical team have never been inundated quite as much with trying to investigate and challenge some of these claims. And it is very difficult to sometimes just get the end user, the person who's making the buying decision, to actually have a consistent guidance that's going to safely and does not encourage complacency in the workplace and provide safety. And really it comes down to good old-fashioned traditional stage 2 cleaning, where you don't have a COVID situation. Then really the use of virucidals is really overuse, and really it's coming down to getting back to cleaning properly, safely, and where you do have COVID situations, absolutely using and following the manufacturer's guidance, using virucidal disinfectants. But I think for us, it is very, very worrying what we are seeing in the market, and there seems to be little or no control of it, and monitoring. And even with the health and safety executive, we have reported a number of companies who we are seriously concerned about, and those complaints have been upheld, just because we feel it's wrong, and it's encouraging complacency in the industry, which is trying to get back on its feet.
I agree. It's been very difficult to actually challenge some of these claims and to find the right enforcers, really, sometimes. So certainly, you know, it might be the health and safety executive. On occasions, I have reported things that I'm not happy with to them, and I haven't really had much satisfaction. I've also been speaking to trading standards, but you need to then speak to the trading standards department in the authority where the company is actually based, and there's no national control of this. So I think BEIS has also been interested in the advertising authority as well. But it's not quite as straightforward as if there was a food issue. We'd know where to go with that as a central agency. But this sort of falls into a number of different stools, because it could be a trading standard issue, it could be an advertising issue, and it actually could be a health and safety issue. And often it might be all three. and it's quite difficult to find some joined up thinking going on at central government. And I must say I have tried to raise this, as a number of people have, and it hasn't always been successful. And the only thing we can also do is to make sure that it's sort of buyer beware, and to spread the message that we have to treat all these claims with extreme caution, and think very carefully about what we are trying to achieve and where that fits into our COVID risk assessment, or any risk assessment. What are we doing? What are the most important things to do? And which parts of a building do we need to disinfect, if we need to disinfect at all? But of course, we have to bear in mind that people can be carrying COVID without having any symptoms. So maybe up to 50% of people who have COVID are not showing any symptoms. So we almost have to assume that everyone walking into a building could be carrying COVID until it's got down to a really low amount in the population. Haven't reached that point yet. So I'd still say that regardless of whether there is a case, we need to disinfect high frequency surfaces. We need to make sure that people sanitize their hands before they enter a building. And then we also need to implement all the other COVID controls, such as ventilation and social distancing and face covering wearing.
Thanks. I think, you know, so many companies have been sort of almost reacting in panic, haven't they, and fallen foul of some of these claims as things have been changing so rapidly. Deborah, I see you've put a couple of comments on there about deep cleaning. Would you like to discuss those with us?
Yep. Yes. Hello, sorry, I had to find my mute button there. Yeah, it was just to say that from a deep cleaning perspective, the only time that we would recommend that would be for food manufacturing or food service that had following a period of enforced shutdown, and that would be related to food safety rather than control of COVID. So just to follow on from Lisa's point, I still agree entirely with what she says, but it was just to clarify about the deep cleaning on the food manufacturing.
Yeah, absolutely. I mean, for example, for listeria, then that is a different matter altogether. But definitely in relation to COVID, I just don't feel that I think we're barking up the wrong tree, really.
I think touching on what Nikki was saying as well, we've seen, haven't we, Lisa, people saying that playgrounds are COVID secure for 28 days because they've been sprayed with some chemical. You know, nothing about how distant the kids need to be when they play. It's almost like they can be on this magic play area and they're going to be COVID secure for 28 days. And this is councils that were putting this out. So I think, you know, that was the concern, is that there's just a lack of knowledge and just panic about how people can open up playgrounds and schools and bars and restaurants.
There's a lot of nonsense talked about COVID security, that's for sure. And it's quite easy to put a little piece of paper up saying you've ticked all the boxes and sign it off at the bottom. But what really matters is the risk assessment and the quality of the risk assessment. And have you thought about all the routes of transmission, and have you tried to reduce those risks of transmission? And of course, you know, in a playground, whatever you spray all over the equipment is going to come off fairly quickly if it's just a chemical. And is it necessary anyway? And of course, you know, the most important thing for the children is that they're spaced out a bit, and if they come off the equipment, that they then sanitize their hands before they shove their fingers up their noses and in their eyes.
Thanks. I see Nick has put a comment on here about the HSE being more robust in their guidance. I certainly agree with that. But it's interesting, you made the point, I think, Paul, about local authority. I think it's a question of everybody jumping on the bandwagon. My local authority has appointed a COVID czar, who, to the best of my knowledge, has no experience in public health or epidemiology, and is putting out some pretty stupid comments. Anyone else got any questions or comments for Paul or Lisa?
I think I could just fill in a little bit with my absolute horror of people wearing single-use gloves. You know, this really winds me up. You know, people are sort of saying to me, "Oh well, I'm obviously absolutely safe from COVID because I've got a face covering on. Yes, I'll give you a tick for that. And then I've got my gloves on as well." And you just think, well, you know, really, I've seen people wearing gloves for many minutes, and during that time they're scratching their face, they're touching something, they're scratching their face again, not changing the gloves. You know, a terrible waste of resources, terrible waste of money, and actually not really very helpful at all, because people forget why they've actually got the gloves on. COVID's not going to go through their skin, but it is going to go into their eyes or their face if they scratch their face while they've got those dirty gloves on. So I'd like to see the gloves out completely banished, unless of course there's a clinical reason for someone to wear some, or a food safety reason for someone to wear them, and even then you'd have to convince me.
Sure. I remember when this first kicked off, we're going back almost a year ago, it was quite common to see someone driving around in a car on their own wearing a mask and gloves. You don't see so much of that now. But Luke, do you have any sort of information, feedback on the percentage of people that do use sanitizers when going into supermarkets? Seems to me that it's a pretty high proportion of people that queue up to do that, which is encouraging, isn't it?
Well, that's encouraging. To be honest, I avoid going shopping still as much as possible, and get anything I can delivered, or go to a very small farm shop nearby, just because I don't want to be in any environment where there are lots of other people. But when I have gone to a supermarket, I'm actually quite surprised about the number of people who do dive in there and don't do anything about sanitizing their hands or the trolley handle. And I think maybe it depends on the demographic and the type of shop. But I mean, I've got a corner shop, a convenience shop, and there's no sanitizer there anyway. And you can push your way in without touching the door, but when you come out, you have to touch the door. So obviously that's a case of having your own personal sanitizer. And I sort of leap in there to get a newspaper and leap out again on a Saturday, and that's about my only engagement with the place. But I mean, there's absolutely there's nothing going on there in terms of helping the customer to stay safe.
Yeah, as I say, perhaps I've been lucky in the shops that I've observed, but I do know that for people working in retail, there's still a huge problem with customers who refuse to wear masks, for instance, and get very abusive and even violent if they are challenged.
Well, that is a problem, and that's going to happen when the pubs open up again. And there certainly have been a lot of instances of people having abusive behaviour or violence directed towards them, which is completely unacceptable. But it is very difficult, because as part of the risk assessment and the legal requirement for people to wear them, then that is what should be happening. My personal opinion is that if you can't wear a face covering, then maybe you should try and get someone else to do your shopping, or not go into these environments, because we don't know, even if you feel perfectly well, you could be carrying COVID. And is that fair for you to be putting other people at risk, even if you have an exemption for the face covering?
Absolutely. Yeah, I agree with you there. Alison, you made a point there about sanitizers being available as you were leaving the shop. Do you want to talk us through that at all?
Yeah, I mean, when it first happened, I was a little bit like Lisa. I was like getting my shop delivered, and I'd go in when I had to. And what really frustrated me is I would sanitize when I go into the shop, go around the shop and everything, and then I'd be like, you could see it, but you couldn't get to it because obviously they got the one-way system. So I had to carry my own sanitizer because I've been in the environment, and I suppose there is a little bit where there's that bit about we're food safety professionals, so we kind of understand when contamination could happen better. But I do think probably when we came out of the first lockdown, I sent to note, certainly the supermarkets where they got one-way entrance and exit, they had started to put sanitizer as you leave. So you've still touched the trolley, but it's all about risk, isn't it? And it was just, for me, it was like, well, I can now sanitize before I get back in the car. To the point about seeing people drive around with face masks on, I am a little bit guilty of that occasionally. If I forgot my hand sanitizer and I'm going into another shop, I don't want to take my face mask off. So there are some people who do it occasionally, although it does fog up my glasses and I can't see very well. So maybe the bigger risk is a car crash. But I do think shops have got better at providing it. I still worry about when you get to some sanitizer and it flows out like water, and you wonder what the dosing, what the dosage has been. But I think it has got better in terms of going out. But I think going to the pub, I think if they can go back to you wear a face mask when you're stood up and start with that, then it might. I think it's the changing rules has not helped either.
Mm. I think the other thing is in my local pub, even though we were sitting outside, the last when we were last allowed to go, there was some bar staff who weren't wearing face coverings because they said they were exempt, and I actually don't think that's acceptable. Because they're leaning over people, they're mixing with a huge number of people, and of course, if they actually were carrying COVID, then they could infect an awful lot of people. So, I think this sort of needs to be revisited. Is that role appropriate for someone who can't wear a face covering at the moment, where we're really trying to keep a lid on it when we do start to open up after lockdown?
I think it's an issue here about the number of people who say they're exempt and the number of people that really have a valid reason for exemption. And as you said, Lisa, if you have a valid reason for exemption, perhaps you shouldn't be out in public areas anyway at the current time. Mm. Any other points from the delegates here? No, all quiet. Any final points from you, Paul?
No, not really. I was just curious to see if if people are getting confused about products that are out there that are making claims. I know I touched on it in my presentation, but literally we see people are making claims on products that the virus would have become unviable anyway, and it's just quite worrying, as you say, whether it be a very dilute hand sanitizer or someone spraying a fogging of a chemical. I mean, they're saying that chemicals are in them. We don't know. There's nothing really to hold people to account, and I think that is the concern when everyone's trying their best. I mean, things like track and trace as well. Unless everybody does it, if we half-heartedly all do it, it doesn't really make any difference if we go to the pubs or restaurants. If we're not all mandatory having to do it, because you can write whatever you want on the forms. I know when you look at Australia, these big events they've got, it's 100% mandatory track and trace, and that's the only way you're allowed in, and it all has to be on an app. That's just the joined up thinking, I think, of the general things that is still a concern.
I think also, Paul, one of the things is the track and trace seems to have just disappeared. Yeah, the things are up there, and I don't honestly know if I go into a takeaway coffee shop to get a coffee. I normally use the drive-through, but if I go in, do I need to track and trace anymore? It's not clear. So, people don't know what to do, and they won't know what to do when it opens up unless it's clear. And then I don't think in this country there's a lot of trust in the track and trace, which is the other challenge.
Yes, yeah. I think people are just worried that they're going to be told to stay at home, and they don't even know what danger to put themselves in. And they think they've stayed 2 meters away from everybody.
Well, I think there's still a lot of confusion about how many meters you should be away. I mean, there's a place in my town where they ask people to queue 1 meter apart. And you think, well, where have you been? I actually saw one high street where they had one shop had 1 meter apart marked on the pavement, and another had 2 meters apart on the pavement. So we just need to have an easy number, don't we? One or the other, and everybody stick to it.
Mm-hmm.
I like it where you've got a sign outside shop saying stay 2 meters apart, and they've helpfully put markers, high-vis tape or something on the pavement, which is nowhere near 2 meters, so it adds further to confusion. There's another comment on here from Nikki. Is there anything else you'd like to say about that, Nikki?
Yeah, it's just really, it was just what we have seen is obviously, when we go out again and the industry opens up, I think for us, the continuation and extension of the deregulation of hand sanitizer, I think is another worry, because there's a lot of ineffective hand sanitizers out there. And I do know the MHRA are very quick to get on these cases, etc. But for us, I think it's just making sure that people understand washing hands, and I say following all the other government, as we've just spoken about there, distancing, But for the industry, in order for the hospitality industry to we all have to open up properly and stay safe. It's also their responsibility as well to make sure that they've got good hand washing facilities. And I think this is where we're still seeing a huge amount of evidence, even last summer, with hand dryers rather than paper towels. And, people not effectively drying their hands and leaving the washrooms. They may have washed their hands with soap, but they're still wet. And I think what we would like to see is just a lot more emphasis, particularly in our hospitality industry, to encourage good hand washing protocol, but also giving confidence back to people, with the use of good quality hand sanitizer products that work effectively and are proven to work and have had to undergone rigorous testing. I think for us that is very, very key.
I think, that's something I can take on board as, in my work with UK hospitality, to just re-emphasize the fact that people need to buy quality products that are proven and will work. And I think from the customer's point of view, they probably want to get out of the washroom as fast as possible, to be honest. I certainly would. So maybe we have the hand sanitizer outside, so you've come through all the doors and there's some on the wall there or on the table. A lot of them have put the little table with the hand sanitizer there, so that people can sanitize their hands even if they haven't had a chance to dry them, because let's face it, some hand dryers are very, very slow and there's no way on earth you'd catch me standing around waiting for that to work. But we've also got to remember that many hospitality businesses have been absolutely crucified with this. They have been out of action. They've been in and out and in and out. They make all these changes at huge expense and then they have to be closed. So, they probably haven't got time to do something or the money to actually change the hand dryers, for example, but putting some hand towels there would be a good first start.
Thanks. A question here from Laura Brown. Do you see a future for antimicrobial viral ingredients added to factory protective clothing?
Well, I mean, it wouldn't be a bad idea, because you would, we wouldn't be just eliminating or reducing COVID. I mean, this would be something for other food poisoning organisms as well. But I think what we've got to remember is that we've still got to have the hygiene controls. And I know Biomaster are very keen to say that on top of having the protection of an antiviral or an antimicrobial additive, there have still got to be the normal hygiene measures that need to operate in the time between the time of the reaction with the additive on whatever surface it actually is. So it's not an instead of, it's an additional way of protection.
And that's, yeah. And we've always said it's this second line of defence, and we're always trying to push the fact that hand washing is the key. But looking at workwear, as you say, you can wear it for a whole shift. If you could reduce a virus, because it would be classed as a porous surface, in less than 2 hours, but it would also work on bacteria. And it still horrifies me. I mean, Polygene, who we're now partnered with, that just do textiles, I would say over 95% of their business is on textiles to stop them smelling, to stop the sweat smelling. And and I always think people are willing to pay not to smell, or people are willing to pay to save someone's life or to stop someone getting food poisoning. And we've got it the wrong way round. You could have a workwear garment that people, body odor wouldn't be an issue. It would stop the growth of bacteria on it and have some antiviral performance. But it sometimes comes down to the cost. But then if you're buying an Adidas shirt and it's going to cost you 50 pence more because it won't smell if you go to the gym and then want to go for coffee, people will pay it. But you tell a hospital their uniforms are going to cost 10 pence more, just doesn't happen. And they just carry on, and people going home, washing their uniforms at 40 degrees in their family washer, thinking they're doing a great job, and just contaminating everything. So there is that joined up thinking again. And I do think in workwear, there's a big application for it. But I would say, as what Lisa said, it's probably more in the food poisoning side of it in terms of the antiviral, but it would do both things.
Well, also, skin infections, for example, MRSA. It is, I would hope that this is teaching us that actually it is not acceptable for staff to take their to take their laundry home, to take their workwear home. This should be professionally laundered. shouldn't go anywhere near the house, particularly from healthcare settings. You're basically just spreading microorganisms around the community, and everyone associates MRSA with hospitals, but actually it's in the community, it's being taken into the community, it's being taken into your washing machine, and if you're using a low temperature wash, then it's highly likely that it would survive. So, you know, I think there needs to be a rethink about this. It's a cost-cutting measure to make staff take their uniform home, but it's not hygienic. It's not hygienic in a food factory or in a restaurant or a catering premises, and it's not hygienic in care settings, whether it's a hospital. Obviously they would control that more, but you know, it wasn't that long ago when nurses were wearing their uniforms when they were walking outside the hospital. We've got to stop this. We've got to start thinking about how to stop the chain of infection, and uniform doesn't have a place at home. It's a work thing, and it needs to stay there and be laundered properly.
And when it all first hit last year, we were inundated from local hospitals about whether we could help in terms of PPE, and people literally just polyethylene extruders were just making rolls and rolls of polyethylene with additive in there. But also, we've donated thousands of our bags for life to local hospitals because they said we've got no way to take the uniform home. Not only have we got to then take it home, but we don't want to contaminate anything else. So we just donated loads of bags, and every time we did, we said, make sure you wash everything on a high temperature, because they weren't being told to wash it at a high temperature. They were just being told to just put it in the normal laundry, and the chemicals will do their job, or the water will do their job. So it is worrying. And I think, you know, MRSA as well, you know, you look at that, and hospitals at that time, they have reduced it. I think it would cost them something like 1 pence a garment extra to wash with the proper biocide, you know, like Dettol do with their In Wash one. You know, it does work. If you're going to wash at a low temperature, you need something.
Yeah.
Question here from Lisa. What temperature would you recommend for washing? Sorry, that's Lisa Bryan.
I would say 60 degrees plus. And
right,
if your work uniform says it won't take that, then I would question that anyway, because you know, give it a try and test it out. And then if you're specifying workwear, then make sure that it is possible to launder at 60 degree plus. And do remember as well that the washing machine may say 60 degrees, but it may not actually do that. I mean, which survey some time ago showed that a lot of the washing machines never even reach that number. So if I know something is particularly contaminated and I know that it can withstand a hot wash, I'll go up to 90 degrees, because then it's belt and braces, but a minimum of 60, and use a powder, washing powder, because they are likely to have oxidative bleach. If they are a white goods washing powder, they will have some bleach action in them as well, whereas the liquid does not, because it's not stable in those products. So you can do a number of things. You know, I'd go for 60 and powder, and then if you have to go for a lower wash, then use a laundry sanitizer additive such as the Dettol one. But there are other makes around now that have also produced those. But you know, I can't stress enough that we need to think about where we can actually break the chains of infection, and laundry is one of them.
Because we're bombarded now with messages to wash it 40, aren't we, to save the environment. Laura Brown's put a comment on here that in today's paper it suggests a temperature of 67 degrees for washing. I don't know how you would measure that on a conventional washing machine.
Well, you're not going to, are you? I mean, as I said, if I think you know, my bedding and sheet and lawn towels go on 90. And the other thing is to give your washing machine a treat every now and again, like every month, and put it on 90. Put something in there that like you know, white bedding or white towels, because that will actually help to cleanse the washing machine as well. And some washing machines actually have a cleansing cycle. I think mine does as well. Every now and again it bosses me around and says it's time for you to do a deep clean, and that's, you know, it's important to keep the machines clean as well. It's just the same with the dishwasher, you know, and don't get me started on low temperature dishwashers as well, and ones that can see the plates and give you the right temperature accordingly. They can't see the bacteria, but you know, just 67 would be great, but you know, we're not going to achieve that. So if you want to do 60 and put an additive in as well, just for good measure, or use a white powder.
Good tip. Francis put a comment on here about commercial where laundries will wash at high temperature and then dry at a very high temperature. Yeah. Lisa Bryan again, surprised by the lack of knowledge of the airline industry and the measures or lack of that they have for hygiene in cabin interiors. I noticed a huge variation in the various measures that different airlines have taken. Some of them seem to have taken them for cost cutting. But any comment on that, Lisa or Paul?
Well, I know I just recently saw that BA have partnered up with Dettol. I saw an advert for that. So it seems that they, a lot of the airlines are taking this more seriously. And are looking at ways of reassuring the customers and actually improving the hygiene of high contact surfaces. And I know Paul's been working with the airlines as well. Maybe you want to talk about that, Paul.
Yeah, again, we're just looking to get surfaces that give some added protection, but we're still insisting that obviously you can't just kick people off and half an hour later bring new passengers on and everyone's going to be sanitized. It's still quite worrying that we see quite a few that after we've spoken to them, say they're going to go the fogging route, and particular foggers that they've got, some of them are quite corrosive. And you try and say to them, you're on an aircraft, you're going to then spray something that the aircraft interior hasn't been approved for, and some of it's mildly corrosive. And I don't know, it doesn't seem to get the reaction that I would hope that the aircraft industry would have, because they're just looking for an easy fix. But that's just some of the smaller ones. It was some of the private jet people who were just looking to purely do foggers because it was too complicated to do anything else. And again, saying we're going to fog once every 365 days because we've been told on the can that it'll work. So, you just have to let them, you say, look, you need to check that out. Please do.
But actually, really, you can also give your passengers a protective wipe, so they could even grab. You can imagine what I'm like on a flight, even before COVID. I've got my wipes and I wipe everything around me because I don't want anything. I don't want norovirus as well. So I will do the tray. I'll do the remote control if I've got one of those. If I'm in a posh seat, I'll do the screen if it's a touch screen. I'll do the seat belt, everything. And I'm the same on a train. But airlines giving everybody the opportunity to have a wipe that's been approved, that isn't going to destroy the structure of the plane, it would give everybody a feeling of a bit more satisfaction. And I know my daughter, of course, very, very aware of this, sent me a picture she was on a Turkish Airlines flight last year, and she said, look at my hygiene bag, Mum, I've got this wipe, I've got this sanitizer, I've got face covering and everything all in the bag that was given to her as she went on. And fantastic. Reassure the customers and actually allow them to take some control of the environment they're sitting in and give them that reassurance.
Yeah, I think so. And I think the key is, I think if you were to go on and someone said, well, this surface does have some protection, but we're giving you a wipe now to protect yourself, that's got to be the key. But in theory, when vaccines and travel passports come through, aircraft in theory could be one of the safest places to be, because you'll know everyone supposedly has a very low likelihood of having something.
Lateral flow testing before you're allowed on. That would be another possibility. You've got plenty of time to wait for the results, haven't you? While you're waiting around in the airport.
And the airline industry is predicting like a massive boom after all of this, because as soon as it is safe, everybody's going to want to go abroad. Flight costs are going to be horrendous, and they're not going to be able to keep up with demand. So, although it's been a tough market to be in, they're actually saying that there's going to be some boom years to come because everyone's desperate to get away.
I'm still trying to get my head around the thought of using corrosive chemicals inside aircraft, but we'll move on from that. Comment here from Colette, who's a nurse, and says she has to wash her uniforms at home, and only certain areas of the hospital, for instance, operating rooms, have professionally clean scrubs, and that sort of speaks to what you were mentioning, exactly. Lisa. Yeah,
I think I've got a campaign coming on, actually.
Yeah. I wonder if we can talk about this later, but this whole issue of trading standards and HSE controlling the industry and looking at some of the claims that are being made. Nikki, you've made another comment here about fogging.
It was just very quickly. I think this for us is a source of real concern. because you're effectively not just for the users, but also the cavalier attitude that we're seeing with people marketing such products. Well, as a chemical manufacturer, we can only test the chemical inside the product. So inside, for example, it will depend when you're fogging and misting, depending on the device. There are no tests at the moment across the world that can effectively prove that using a quat that can work on a normal traditional method on a surface will still be as effective in a misting or fogging device. There is a real danger with shadowing. So when you let these little chemical bombs off, there's generally, you are putting them into rooms where there are lots of little crevices, shadows, shelves, etc. There is no guarantee that those products are actually actively landing on those surfaces. Secondly, as well, you're having to use these devices in completely sealed areas where nobody can enter, etc. And again, how do we test that you can actually prove that the product has been effective? Because as soon as you enter into that room, you are obviously contaminating that room once again. So again, it's also the danger of, if there's fabrics, electrics as well in there, there's a danger of chemical sink. And with quat-based products, disinfectants and biocides, there is a real worry and concern of what the impact will have on long term with not just operators, but somebody going into a room that has been treated with one of these methods. So I think until there is proven tests and we can test them properly, I think we as a company would not recommend this process at all. It would be very much down to stage 2 cleaning with potential, if required, you could fog, but certainly you have to have very strict controls in place. And until there is testing available to prove that efficacy, it is very, very wide open.
I totally agree with you, Nikki. And I was horrified to read about self-catering accommodation being encouraged to use these fogging devices, and people were being the cleaners were being trained up to use them and actually making quite a lot of money because the holiday companies were insisting on it, and they were actually opening cupboards up and spraying inside cupboards. So you can imagine in the kitchen you've got a stack of plates. I mean, this is just total nonsense. It's not even going to hit the second plate down, but even if it did, is that safe for the consumer? It'd be better to just put everything through the dishwasher.
Thanks. A final comment here from Laura. Thank you for that. This the study about 67 degrees has been reported by De Montfort University and published in the press today. So thanks everybody for taking part. Are there any sort of final comments before we close down?
I think for me, it's really go back to the risk assessments. Always think about that. We're going to end up with, lockdown being released and more businesses opening. They need to revisit that risk assessment and implement that, and be very, very sensible about the use of chemicals and use them in a targeted way, because that's really you could miss with a smoke bomb. You could miss, or a bombing approach. You could miss the very things you actually need to disinfect. So it's really to do with a sort of systematic approach, a calm and sensible approach, and don't just throw everything, all these chemicals around in a room willy-nilly, which may not actually be effective at all.
Sure, thanks. And from you, Paul?
I'd say exactly the same. We're on the same page as that. I think some of these fogging and misting devices are really horrifying. Just as horrifying as some of these companies also have baby hand sanitizers with quats in, which again is pretty horrific, but no one seems to be doing anything about it. So I think, yeah, we just have to go back to basics, and cleaning is always going to be the main weapon that we've got. And yeah, I hope that this hour has been useful in terms of what everyone's thoughts are. But it's great to hear that most of us as professionals are all on the same page.
Yeah, that's true. I think it's getting, as Mike has said, it's getting the message out to the wider population, isn't it? So thanks everybody for taking part today. We will be following it up, and as I say, thanks once again, especially to Lisa and Paul for leading the discussion today.
Thank you very much.
Bye. Goodbye, everybody.
Bye.